So we're going to do a reaction video to I Tried PRP for Hair Restoration. This is by Macro Beauty from Refinery29. We just launched a weekly newsletter called Hairlines. You can subscribe by going to hairlinesnews.com. It's also going to be linked to the description of all of our hair videos, and let's make it happen.
Hey, it's Carly, and today I'm getting PRP for hair restoration with Dr. Michelle Henry. I have
She's a friend of mine.
Been dealing with a lot of hair loss lately. Really, since 2020, my hair has struggled.
So she's saying that since 2020, she's had issues with her hair. 2020, of course, was, the pandemic, and it was a common time for people to start to lose their hair. Some of it was stress-related, some of it was related to the actual virus and telogen effluvium that can come from the impact of the virus.
Find out if it is worth the time, the money, the pain, and I want to know if I could recommend it to a friend.
Yeah, so definitely. So PRP requires that patients come back to the office, whatever doctor they're going to or whichever clinic they're going to, every usually month for about 3 months in a row, and then every 3 to 4 months after that. And so it does require this constant sort of upkeep. So it's not like a one and done. This is not a hair transplant. This is something that can be viewed as a maintenance for your hair. It's a form of medical therapy. We've talked about it many times on this channel. Make sure to check out our videos on PRP for hair loss. So it does require time. Of course, it requires some degree of money because each time you're going to the doctors, you're paying. So you have to consider that as an option compared to some of the other medical therapies that are out there. And then she mentioned pain. Yeah, most of the time PRP is performed with needles. So there's needles to numb the scalp. Sometimes people use topical anesthesia, but usually there's some degree of injections of numbing medication, and then there's the actual needles that are used to instill the PRP.
Hair loss has been a huge insecurity of mine for the past several years. I really noticed it when the pandemic started.
They're bringing it up. That's what I said.
A lot of it was from stress. I also knew that it was genetics, that it runs in my family.
So what I'm seeing here is that on her scalp, there's like a central widening. The part line is starting to widen, and usually that's a sign of female pattern hair loss, the androgenic alopecia version for women. So that's what I'm seeing in this person here, where you're seeing this sort of widening, essentially a very classic type of pattern. And so when she says that it runs in her family, that makes sense with the pattern that I'm seeing here.
It was coming, but I didn't think it would come so soon. I also had an eating disorder.
You can see the lack of density here on the temple and parietal scalp, as well as what we're seeing at the part lines.
Unfortunately, I've tried so many pills, serums, foams. If there was an Instagram ad, I probably have bought it, but nothing has worked for me.
So when I think about medical therapy for women's hair loss, and we talk about this in our Jada Pinkett Smith video, so make sure to check that one out. I think of, again, certain categories. So one would be minoxidil, both as a topical and an oral form. Then spironolactone. That has been shown to have some anti-androgenic qualities and has been overall reported to be effective for many women with hair loss. Then there's PRP, which is what they're doing here. There's laser light therapy. There's microneedling. And then for women not of childbearing age, finasteride will sometimes become an option. So those are the general options to choose from. Everything else, like the shampoos, the conditioners that are out there, they might be a nice adjunct, but they're not a replacement for the core medical therapies that exist.
Pain is the number one fear. The thought of something being injected into my scalp is a little freaky. I'm also just worried that it's not gonna work.
Yeah, a lot of people are worried about pain. And again, you can use topical anesthetic, but I find that that's not as effective as injecting anesthetic, which is what we routinely do for hair transplants anyway. We do something called a ring block, where we block around, starting with the hairline all the way around, and that really does a nice job of anesthetizing the area. Since the nerves come in from the front and from the back generally, you don't need to go in with numbing throughout the whole central area, just basically in a ring. Once that's numb, then you can go ahead and do the PRP injections. People really don't feel anything.
Expecting like a full head of hair overnight. I know that things like this take time. So I've been looking into PRP for the last year, and the biggest factor, aside from the fear of things being injected into my scalp, is the cost. This is a huge investment to do this treatment.
Yeah, think of it like Botox and filler for the face, let's say. So it's very similar, PRP for the scalp. There's a recurrent cost that goes along with it, and you have to keep that in mind when you're picking a clinic or a provider who will do this for you. It's not only that, it's also the system that's being used. So in our practice, we use the M-Site system. As you guys know from our PRP video, the M-Site system has been shown to generate the greatest concentration of platelets. So that doesn't mean that it absolutely equates to better results, but it does mean that there are more platelets generated, which are what have the growth factors inside of them that do the work when it comes to PRP for hair restoration.
So what I typically do with PRP is I do 3 to 6 treatments.
Okay.
So I do monthly treatments for 3 months, and then we decide, I look and I say, are we seeing any response? I try to customize it a little bit because not everyone's a responder.
Yeah.
Many are, and it's a great treatment.
Yeah, exactly how Dr. Henry described it is how we do it in the practice as well, and that's how the studies have been done on PRP.
Happy patients,
Yeah.
and not everyone responds. So I find it fair to take that kind of staged
Right.
approach.
Yeah, so after the first 3 treatments, we usually space it out every 3 to 4 months.
On the market, there are many different kits, and so the price range could really be anything from maybe on the very low end, $700 or $800, to $1,200 or $1,500 per treatment.
I've even heard of some places charging upwards of like $3,000 for one treatment of PRP. That is out there, so the high range can go even higher. But in our practice right now, we're charging $1,000 for PRP. Keep in mind that pricing can change. So sometimes you guys contact us and you say,
"Oh, in one video you said this."
Well, that might be true today, like when it might not even be true by the time the video comes out. But keep in mind, prices do change over time, and that goes for our clinic, that goes for other clinics. So don't hold me to it.
Just got my blood drawn. Normally I have to get it in my hands because they can never find a vein, but
I once had a guy who I just couldn't get any blood from, and ultimately ended up getting it from like his finger, and it was super weird, but he said like that is how people normally get blood from him, and I found that super bizarre.
now it's time to spin it.
So I'm seeing here the device that they're using, the cell fill, which is, again, one of the devices that are out on the market. In our practice, we prefer M-Site, but there are different options. And it's not just about the kit and the machine that's used, it's how it's also introduced into the scalp. So all of that matters for ultimate results. And then, of course, keeping the patient calm and as comfortable as possible during the injections is important.
In the centrifuge, you'll see that it separates. So first it goes in with just the red blood, and when we take it out, you now see the red blood cells below, and you see what we call liquid gold on top, and that's the plasma. We then transfer that plasma into another vial, which helps to activate those growth factors. And from that vial, we then draw it up and we inject it.
The key is that the stuff that's going into your scalp shouldn't be clear yellow. So as you can see here, there's a murkiness to what they're going to be injecting, and that's good. That means it has some platelets in it. If it's completely clear, it doesn't have platelets because the platelets take up volume and they give the appearance of murkiness.
When I inject, I use a little tool that's like a little T-shaped scalp vibrator, and it helps to kind of trick the nerves into not feeling the pain as much.
So it looks like maybe Dr. Henry doesn't do numbing. She might have already numbed the patient, it's not clear. But another way to reduce the pain and discomfort is with this vibrational type of tool that she's using in her left hand. And that's a very nice option as well for basically, like she said, tricking the brain to think that that vibration is standing in the place of the pain fibers activating. Also, I like to use some betadine to clean the scalp. There's different cleaning solutions as well to first prep the scalp before you're ready for the injections.
Rich reservoir of growth factors. And so what the PRP does is it gives you those great growth factors, and they're also anti-inflammatory agents to perk up, wake up, and restore those hair follicles.
Some people actually ask me, like, why aren't you putting in the red blood cells, right? Because we take the red and we discard it. And the reason is that red blood cells actually have pro-inflammatory markers. So if you want to reduce inflammation in the scalp, you don't want to be injecting the really, really red stuff.
Just got PRP. It was not as bad as I expected. However, I have a major headache right now. it's rough. But she said it'll go.
With the injected numbing, patients walk away with feeling almost like they have a helmet on their head. Not really a headache, but just like that kind of numb sensation. But then when the numbing wears off, yes, you could have a headache, and that can linger into the next day as well. And usually there's like a little bit of irritation or a little redness to the scalp that also occurs with the PRP.
I don't know. I feel like the high, I guess, and excitement of the day is kind of wearing off. And now I'm like sitting in my feelings a bit. I feel like today I was not really like digesting the magnitude of the moment. And
I mean, this is a temporary type of improvement, even if she has improvements. So, there's nothing permanent that was done here. So shouldn't ponder about it too much. It's just going to be a question of, does she continue the treatments later on or not? She did not get a hair transplant, so it's not like there's anything here that can't be undone. I mean, the effects will wear off. It's kind of like a Botox in a way, if you will, analogous to, of course, a totally different mechanism, but even if she didn't like it, she'll be fine. This headache will go away and everything will go back to normal.
I don't know. I'm feeling really hopeful and excited, but obviously also just nervous that it's not going to work. This is a very intense, expensive option for restoring hair, and I fear that even this won't work for me.
Like I said, different options, right? We talked about all the main categories. The other option would be scalp micropigmentation, which is like a type of ink that's applied almost like microblading, but as a dot-like application on the scalp, and that can reduce the contrast between the lighter scalp and the darker hair. And we have a video on scalp micropigmentation with John Giro, so make sure to check that video out as well.
It is so hard, especially as women, because it really can feel like our hair defines like who we are.
Men feel the same way, I'll have to say that. And then on this channel, it does also feel like, a lot of our videos are geared more towards men's hair loss. Women are affected by hair loss almost just as much. Sometimes the therapies are less overall effective for women as they are for men. It can sometimes be a more predictable treatment to apply it to men. But of course, women go through something very similar, and there are definitely options that can help women with their hair loss as well.
On PRP, so I got my first treatment last month. It went really well with Dr. Henry, and I'm so excited because I am going into my second session soon. I feel like this is just the beginning. The hair I'm putting out in the universe, it's coming back. We might not have the full head of hair we used to as like a 6-year-old, but I'm putting the good vibes out there. So
well, I'm digging the enthusiasm and the optimism. That's really good. And a lot of times it's how we set ourselves up psychologically that can get us through these difficult situations with hair loss or with other life scenarios. We know you enjoyed this video on PRP for hair restoration, so please make sure to check out our Jada Smith video.